Sample collection and transport part 1. Sorry for not posting a video yesterday because I was in the US giving lectures. So today we'll start with sample collection and transport. I divide this lecture into two parts. This is the first one, so kindly pay attention. So why specimen management is an important factor? The specimens are collected and handled may differently affect the outcome of the microbiological analysis. Appropriate specimen management is critical to ensure laboratory effectiveness and acceptable turnaround time. Specific guidelines on specimen collection are necessary for optical use of biological. So the quality assurance cycle is like this. So you can see that these are the pre-analytical, analytical and post-analytical cycle. Okay. So pre-analytical cycle starts with the patient and sample preparation collection, personal competency, sample receipt and assertions. Analytical is the quality control testing. Post-analytical is the record keeping and reporting. Organization. Support from the top level involving all persons in the organization. Confer literary requirements. Sample collection forms. The specimen. Identification through the collection, patient preparation, receipt and accessing, rejection criteria, processing, transport and storage. The results of any laboratory test is as good as the sample received in the laboratory. So specimen management. So it involves specimen collection, transport, handling, storage and disposal. Specimen collection. So we should know that laboratory responsibilities in microbiology are verification of the completeness of the test results in detail, verification of integrity of the specimen, determining adequacy of the specimen, appropriately labeled, legible and identification of the specimen, determine if appropriate specimens were submitted in the request, identification of the collector, example phlebotomist and patient, enforcement procedures for handling of suboptimal specimens, and sample rejection criteria. So specimens should be collected during the acute or early phase within 2 to 3 days of the viral infection and before antimicrobials, antifungals and antiviral medications are administered. Samples sent through swabs are generally considered to be spore samples. If tissue or needle aspirates are able to be obtained, we can send those samples. The microbiologist is responsible to provide the clinician the appropriate manual or instruction cards listing the optimal specimen collection techniques and transport information. So information for the nursing staffs and the clinician should include the following. First is safety consideration, selection of the appropriate anatomical site and specimen, collection instructions including the type of swab or transport media, transportation instructions including time and temperature, labeling instructions including patient demographic instructions, minimum 2 of the patient's identifiers, specific instructions such as patient preparation, sterile versus non-sterile sample collection devices. Next, minimal acceptable quality and recommendation of quantity. Guidance. Instructions should be written on the specimen that are collected from the patient, like urine, sputum or stool. They should be handled properly. Mostly urine and stool samples should have instructions written on them in several languages, but nothing substituting for a concise set of verbal instruction. So similarly, when the distributing kits for sputum specimen, the microbiologist should explain the patient the difference between spitting in a cup, that is saliva, and lower respiratory tract secretion. They should not send the junior staffs and all. The HOD should teach everyone properly. In general words, specimen should be of sufficient quantity. Specimen should be representative of infectious disease like sputum, not saliva, pus from the underlying lesion, and not for sinus tracts from the depth of the wound, not the surface in case of anaerobic sample collection. Use of sterile equipments and sterile precautions. Transportation and processing of the specimen should be quick. Samples must be taken before giving antimicrobials. This should include the instructions like positively identifying the patient before collecting the specimen, requiring specimen for each requested test, preparation of the specimen, type of collection containers, required volume and timing. Preservation, for example, transport media, proper specimen labeling, special handling like refrigeration. Labeling the sample. So the sample should be labeled with the patient's name along with his father or mother's name identification number like hospital number, date of birth, date and time of collection, the initials of the individual that collected the sample. So enough information must be provided on the sample label so that the specimen can be matched upon test requisition. Requisition is an order form sent to the laboratory. The requisition should contain information regarding the patient history and the diagnosis. This information helps the microbiologist to work up the specimen and determine which organisms are significant in culture. Complete requisition form should include the following: the patient's name with father's name, hospital identification number, date of birth, mobile number, gender, ordering physician's name, collection date and time, exact picture at the source of specimen, diagnosis. They should be according to the ICD-10 CM code. Current antimicrobial therapy, serological investigations are required. Relevant details of previous immunization should be written. Containers in microbiology. The containers must be leak-proof, universal, around 30 ml capacity, unbreakable, tightly sealed, wide mouth for sputum. For cultures with steel containers is a must. Microbiology specimen should never be sent in formalin. For virology, serology and blood examination should be collected in a red screw-capped cylindrical container with a flat base and wide mouth around 8 cm size is required. Some special containers. So special containers should bear the name of the patient and it should be accurately labeled. Reusable glass containers are economical, but disposable glass and plastic containers are generally used. All used disposable containers must be incinerated or sterilized using responsible staffs before discarding. So getting a responsible staff is very difficult. Special container indications. For fecal matter, the universal container should contain a small wooden plastic spoon that is attached to the inside of the screw cap. The spoon is placed on the clean container and sterilized with it. The user removes the screw cap and grabs it with his finger. The patient picks up the single spoonful of fecal matter, drops into it with a spoon and closes tightly. So if there is any delay of several hours are precipitated, so the sample should be collected and sent in a neutral glycerin saline, which is used to preserve the sample. Urine in diagnosis of video, the universal sterile container is used. For larger quantities like complete early morning sample, for example in tuberculosis, 20 or 250 milliliter. So you should take a larger container. It is 20 oz. Okay, understood? Yeah. So such a big container screw cap sent conveniently. For blood and serological examination, the sample should be sent without an anticoagulant in special glass containers or plastic containers where screw cap containers cannot be used. Flip-flop lids are to be avoided as they are very insecure. They can also produce aerosols on opening and may be very dangerous to the staffs. Blood culture bottles. So this is a unique transport media which contains the culture media both of the same quality. Around 50 ml of liquid culture media is used. A metal cap with a central hole or a rubber pop-in should be used. Around 5 mm diameter should be its size. So it should be containing a intact rubber lining. The cap is covered with plastic to maintain sterility. For automated punches like backpack, you can purchase from the vendor. For the collection of serous fluids like pleural fluid, the universal container is suitable. Around 0.3 ml of a 20% solution is recommended to collect samples which are able to clot. So if you do this, the samples will not clot on standing. Sputum. Sputum is very difficult for the patient to expectorate and collect the sample. So a quart wide mouth disposable container should be used. For pharmaceutical examination, blood and swabs. So suitable for taking specimens from the throat, nostril, ear, nose, wound and other accessible regions, consisting of sterile placket of absorbent material, usually cotton wool or synthetic fiber mounted on thin plastic wire. The swab is a convenient but relatively inefficient sampling device. It influences the viability of pathogens collected on it. So inhibition substances are known to be present in swabs of cotton wool and synthetic fibers. Steps to inactivate these inhibitors should be like boiling the swab in phosphorus buffer or coating the swab with serum or albumin or charcoal. Such swabs are also freely available in the market. So swabs, bacterial aerobic, they are cotton, dacron, and alginate, which are usually acceptable. Bacterial and anaerobes tissue is aspirate is recommended. Resist placing swabs into surgery. Use only transport media. Dacron or alginate, not cotton. Cryobrush specimen is a specimen of choice. No wooden shafts. Fungi swabs not recommended. Wooden swabs, not alginate. No wooden shafts or charcoal should be present in the swab. So these are different types of swabs. Swabs for different purposes. Baby swabs, a very fine thin swab mounted on a fine wire that is so small for the small orifices as the oral meatus. Perinasal swab used for diagnosing whooping cough. The swab is passed through the floor of the nasal cavity to reach the sampling area, and the secretions of the nasopharynx are collected. A small swab with a flexible swab wire are required to minimize the risk of damage to the nasal tissue. Postnasal swabs. This is used to collect nasal samples for diagnosing meningococcal caries. The terminal 20 mm of the long shift metal swab wire bent toward the angle of 45 degrees when introduced through the mouth. It carries the swab behind the soft palate to the nasopharynx. It is used to obtain a sample of bronchial secretion from the diagnosis of tuberculosis in patients who cannot expectorate sputum. So laryngeal swab is used in patients whose bronchial secretions cannot be collected by coughing out. Bent swab bearing end, which is longer around 50 mm and should be more sharply bent through the angle of 60 degrees. The pharyngeal washing and throat washing may yield better specimen for virological and other microbiological investigations. For the upper respiratory tract and endotracheal and bronchial sampling needs to be used as a special investigation. High luminance cervical swabs for the diagnosis of gonorrhea and puerperal fever. The swab should be taken from the uterine cervix rather than from the general area of the upper vagina. A swab on the special long rigid swab sticks is preferred, and the size should be around 22 mm. Specimen transport. Trained personnel is required for transport of the sample. Package and preserve sample is appropriate using a triple layer packing mechanism. Determine the mode of transport. Courier ambulance clinical staff can be used for transportation of clinical samples suspected to contain delicate organisms or delay while transporting the specimen from one side to another to the laboratory. The bacteria do not multiply the transport media and only remain viable. When some time may pass before the swab may be examined, and they are especially seen where delicate pathogens like meningococcal botulinum can be present. The swab is placed in a transport media such as Stewart's media, which preserves the viability of the pathogen. The medium is non-eating because the less delicate commensal bacteria is present in the specimen would grow the pathogen and in the protein media. The transport medium is made up of semi-solid agar. Is used in screw cap universal container for a smaller bottle that is heterometrically stoppered test tube. Delicate pathogens may live alive for a day or two in ambient temperature. Deep semi-solid thioglycolate medium is used for. A swab is not the collection device of choice for many specimens, and some of the specimens, especially nasal swabs, are necessary. The laboratory may receive a swab representative of the disease process. Specimens submitted for the diagnosis of otitis media should not be sent in swabs, since the floor of the swab likely to be that of the external layer. The specimen of choice is aspirated from the temporal synthesis technique. So accepting of every specimen is necessary or not. This occurs mainly because the laboratories are either afraid to have no support to say no to a physician to reject the specimen, but we have to reject the specimen so that the clinician will understand the importance of the specimen and patient outcome. Clinicians are not worried about laboratory results, but we should make them aware. We have to promote proper sample collection, and the proper sample should be sent to the laboratory. Sample rejection criteria: unlabeled sample, insufficient sample, hemolyzed sample, wrong tube drawn, wrong specimen submitted, inadequate volume of preservative, insufficient quantity, insufficient quality. Sometimes they take the contaminated samples also, or they may keep samples for a long time, which may turn turbid due to bacterial growth. The infections where the specimen is likely to become contaminated during collection are middle ear, lower respiratory tract, nasal sinus, bladder, endometrium, superficial wound. Specimen storage is very important to store the specimen properly to avoid unnecessary contamination. So you should establish a policy where the sample should be stored to determine the retention time, determine the storage location, proper conditions, and index specimens as required by date of receipt. As a sample is infectious, use all standard precautions. We confirm the receipt date and time of the samples